This video is an introduction to the CARs, or Controlled Articular Rotations. This is a top to bottom self-assessment tool used to assess joint function. So we're gonna start off by working through the cervical spine, coming down, bringing the chin down to the chest, opening the hands down towards the floor, palms out. Take a big deep breath in. And on the exhale, you're gonna drag, starting to look to the left, leading with those eyes, reaching down just a little bit strongly with the right hand, dropping the ear over the shoulder nice and slow, letting the head roll back as we look up towards the ceiling, reaching down with the left hand, rolling that shoulder back just a little bit and reaching down with the right ear to the shoulder. Slowly rolling around, looking to the right, leading with those eyes, bringing the chin down to that clavicle and tracing along. Coming back again to the left, dropping the ear, letting the head roll back, living in those edges, tracing the space of the spine, leading with your eyes to look right, and then coming down. From here, we're going to move to the scapula. So we're going to bring the arms down by the sides of the thighs, and we're just going to trace a box, lifting the shoulder blades up, squeezing the shoulder blades back, sliding them down the ribs, and then trying to bring them forward, trying to feel the activation of the serratus underneath the armpit into the ribs. Sliding up, back. As we go back, making sure that we're not flaring the ribs to get back, but actually sliding those scapula back, reaching down, and then coming forward. Making one more pass here. And then reversing the direction at the bottom, squeezing back, up, forward, and down, back, up, forward, and down. Once again, just tracing those edges, trying to find the end of the range of the motion and squeezing into those corners. Good, then coming out to the side here, working scapular movement from horizontal abduction, squeezing the scapula back together, shoulders up, protracting forward. Think about trying to drag your elbows forward here to get that activation, and then slide down. Once again, watching any flaring of the ribs, squeeze back, up, forward, and down, back, up, forward, down, reverse it from the side view, back, down, forward, and up, back, down, forward, and up. One more pass. Going through the shoulder head here, we're looking for internal and external rotation of the shoulder, as well as abduction, adduction, flexion, and extension. Okay, so we're going to start by rotating out for external rotation, feeling the shoulder heads rotate back, watching any flaring of the ribs or squeezing of the scapula or retraction of the scapula. Just rotate those thumbs back, bring the arms out in front, crossing, up overhead nice and slow, thumbs pointed back, elbows locked. Checking here, making sure that we're not flaring the ribs as we try to bring the arms overhead to get that overhead flexion. If your ribs pop, stop your arms here, bring your ribs back down, test it again. That may be the end of your range. Coming back up all the way, start to turn those thumbs inside, start to rotate, keep rotating. Pausing here to make sure that we're not going to elevate the scapula to come back around, but are actually rotating inside that shoulder head, and then matching the back of the palms down by the thighs. Take a breath in, exhale, reverse it, squeeze back as far as you can, pointing your fingertips down towards the floor, feeling those muscles in the back squeeze, and start to unwind, giving yourself just enough rotation to come back up and over into that overhead position. Opening the palms up and down. Finding that isolation of movement. Just working on feeling the shoulder heads moving around. One more. Once again, checking into those edges. Good. Looking at the forearms and the wrists here, we're going to start to turn the thumbs out, hug the elbows into the side, and then bring those hands up towards those shoulders. Keep turning those thumbs out, trying to squeeze in, feeling those biceps work. Rotate with that tension, and then push down, locking out those triceps. Rotate, pull up, squeeze in, try to turn those thumbs out. Rotate with that tension, come down. Lock out those triceps, rotate up, down. Reverse curl here, bring the back of the palms up. Trying to turn those pinkies out. Keep that tension, rotate, push down. Keep hugging the arms into the sides. Turn those pinkies all the way out, squeeze. Rotate and down. Good, wrists. Bring up to in, down, pulling pinkies all the way, or fingertips all the way back, out to up. Good, just making those ellipses here, trying to isolate just wrist movement, keeping the forearms out of it. Good, reverse here at the bottom, into up, out to down. Trying to keep those fingertips together, nice and straight. Good, shaking that out here. Coming down into the hips, we're going to work on finding some balance through the left limb first, bringing the right leg up. We're going to come across the body here, up into a figure four, into a high knee, bringing the left arm out for balance and slowly bringing that right leg out, making sure that the left hip isn't trailing along. We're going to start to find that knee rotating down, heel rotating up, making sure we're not hiking or throwing the hip forward here, but just allowing for that internal rotation to happen. Very slowly, you're going to trace along that upper edge, bring that leg back and around, keeping that heel hugged in, working that hamstring, and then coming back to neutral. Take a breath in, exhale, squeeze back. Pause here, hug that heel up, feel that hamstring work. Tuck the hips, tie in the glute. Working those two things together, start to open that leg back up out to the side, transitioning that work to the glute med. Side of the hip here, start to pull the knee back, pulling the heel forward. Feel that deep rotation inside the hip, back up to the high knee. Coming around, figure four, without dropping into that hip. Keep it nice and strong on that standing leg, and coming back down. And again, cross, up, high knee, open out, strict rotation. Tracing along the edge, back and around, big breath in. Exhale, squeeze back, tuck the hips, squeeze that heel up. Feel that posterior chain work, open out to the side, rotate, up and around, figure four, and down. Good, reversing, switching over to the other side. Bring the right arm out. Find that balance on that right leg. Coming across, figure four, high knee, open out, making sure that that right hip does not trail. Start to find that rotation. Once again, making sure that the pelvis isn't coming along for the ride, that we're just getting that limb to twist, and then coming back and around, and reverse. Good, pull that heel up, tuck those hips, transition to the outer hip, rotate, and down. Breath. Good. Find that activation in that posterior chain. Tuck under. Switch to feel that lateral hip work. Push that knee back and pull that heel through, keeping that leg squeezing back. Deep rotators. Up into that high knee. Coming around. Figure four, strong standing leg. Coming down. Good. Moving from the hips to the tibias. We're going to once again find that balance on that left leg. Bring that leg up. Finding that hip flexion. We're looking at tibial rotation in and out without movement of the thigh. Right? We want to separate those two movements. Start by externally rotating. Kick out. Internally rotate. Come back in. External out. Internal in. Just a couple of passes here to identify and reverse. Internal to out, external to in. Good. Keeping that knee high, thinking about feeling those hamstrings work that tibia back and forth. Coming down, stay balanced on that left leg, working through the ankle here, looking at its full range of motion, starting with dorsiflexion, toes up, going to inversion here, finding that edge, tracing down to full plantar flexion. Trying to find eversion here, picking that pinky toe up, coming back up to dorsiflexion. Nice slow roll through the ankle, testing range of motion here, building control. Two passes each direction, reverse. Switching over to the left leg. Finding your balance, bringing that left leg up. Finding that external and internal rotation on that side, outside of that thigh movement. Start external, kick out, internal, back. And reverse. And then down into that ankle. Toes up, invert to point, evert to dorsiflex. And reverse. Good. And that's cars. Go through your whole body, check to see where your body likes to move and where it doesn't, what you control and what you can't control. That gives you a good estimation of the things that you need to work on to create a fully balanced controlled system.